So, Dr. Atmik, I think we should start now. It's already 7 minutes past 5:30.
Yes, sir.
People will go on joining. I mean, you can't ensure a perfect attendance right at the start. So,
Mhm.
just trying to, introduce the course, and then you can take over. So, good evening to all of you. I welcome all of you to this fourth demo class or a preview class in line with our upcoming course on sexual medicine. So, I would just like to show you some slides to get a better understanding of how we are moving on. So we are launching the Fertilis Academy. We are launching a course on sexual medicine and sexual health. And Dr. Atmik is one of the lead faculties for this course. So this course is divided into two courses. One is the basic course, which is starting on 15th of January, and the other is the advanced master class. As part of the course, a build up to the course, we started with a free demo session on menstrual cycle, libido, and mood changes, what actually fluctuates and why. Dr. Divya, who is a very ardent consultant, especially for the LGBT community and all, she took this session and she is a physiologist. Then we invited Dr. Mitali, who is one of our lead faculties. She took a wonderful session on sex and pregnancy. Last session was taken up by Dr. Rashmi Patil. She is a consultant psychiatrist and sexologist, and she spoke on approach to a patient of sexual dysfunction. Today we have with us Dr. Atmik Jain. He is a very well-known sexologist in the region and all over India, and he'll be talking on counseling in sexual medicine. I know it's a very monotonous subject, but I've seen his slides. It's a wonderful presentation. You're all going to enjoy his talk today. This session will be followed by we have added another session which is on sex and pain. Very relevant, beautiful session going to be taken by Dr. Mitali, and you must attend this session on 14th of January. That is on Wednesday. Finally, I would like, if you're interested in kickstarting your career in sexual medicine, this is the time and this is the course which you have. You can sit back at your home and learn at your leisure. We offer recordings for the next 60 days after the course finishes. There is a certificate and it's a 100% online course. So you can learn at the comfort of your home. So I'd just like to introduce few topics. Some of the faculty names are missing here. I'm sorry for that. But we start on 15th January. We start with the basics, anatomy, physiology, neuroendocrine pathways, sexual response cycle, and none of these things are being taught in medical schools. So you have to learn it here with us, and because the patients are so common, sexual problems, sexual disorders are so becoming more and more common with changing lifestyle and a different kind of culture in which we are, spending our lives nowadays. We'll be talking on sexual disorders, definition and diagnosis, the pharmacology of sexuality. I feel this is one of the most important topics which we have to discuss. Gender identity, orientation, and culture, again taken up by Dr. Divya. History taking in sexual medicine, Dr. Rashmi will be talking on it. Male sexual dysfunction, Dr. Amit Mutha is going to talk on it. Female is going to be taken by Dr. Mitali. And masturbation and Dhat syndrome, we have a very celebrated psychiatrist and sexologist, Dr. Adarsh, talking on it. Clinical vignettes, all of us will bring some very relevant questions and we'll ask you to bring your queries and questions. And then we're going to discuss this in the last session on 17th of February. So there are just 3 days to go, and this is the time you have to register. We have got many doctors registered already with us. Some of them have also taken up the advanced and basic both together because that's a little cheaper if you take go for both the courses. And some of them have registered for the basic course as of now. So I think this is the time when you should also go ahead for your registration. And this is our advanced course. It starts with the history taking, physical examination, and sexual dysfunction in various psychiatric disorders. We go on to discuss substance abuse and related sexual dysfunction, alcoholics and their sexual issues. And we have in-depth analysis of erectile dysfunction coming from, we have, a very celebrated urologist who is uh, talking a lot on sexual medicine. Dr. Gajanan is going to talk on it. Premature ejaculation, again, Dr. Adarsh is going to come on this. psychosexual therapies, genitopelvic pain disorders, and Mitali is going to take up this is her favorite topic, psychotropic medication, induced sexual dysfunction, genital hygiene, and commonly transmitted sexual disorders. Dr. Murugan is going to speak on this. And we have got then digital media, online pornography, and sexual function. Again, Dr. Adarsh will be talking on it. Sexual dysfunction secondary to medical conditions, female sexual dysfunction, evaluation and management. And finally, we discuss a little advanced version of clinical cases, a little high up compared to the basic ones, and followed by a question answer session, which is going to be part and parcel of all the sessions. But then here, you can bring in your cases, you can bring your doubts, and we are there to solve it for you. So now I welcome Dr. Atmik Jain. He is going to talk on counseling in sexual medicine and a brief CV of Dr. Atmik Jain. He is a MBBS from RD Gadi Medical College, Ujjain, Madhya Pradesh in India. It's a very prestigious medical college. He did his fellowship from JSS Medical School, Mysore. He's also trained with ESSMM, that is a European Society of Sexual Medicine. So he was one of the pioneers who got trained in this school, and he's heading the Department of Sexual Medicine in Motherhood Hospital Indore, and also working as a sex counselor and therapist at Arihant Hospital Indore. He's a member of editorial board of magazine issued by Council of Sex Education and Parenthood International, News and Views. If you talk about his professional affiliations, he is a member of all the professional bodies such as ISSM, that is International Society for Sexual Medicine, European Society. Then he is also keen in learning about human reproduction and embryology, for which he is a member of ISHRE and ISAR, and South Asian Society of Sexual Medicine, Council of Sex Education and Parenthood International. So these are his affiliations, and very impressive CV as far as sexual medicine goes. So I welcome you all to this session, and you can. There are still 2 days to go for your registration, so do register for our course. It will be very encouraging for us as well as for you, because you can enhance your skills, you can add value to your CV, and we welcome you to register for this course. These are the details on which you can contact us. And thank you so much. And over to you, Dr. Atmik. I'm unsharing, and you can share the screen, sir.
Is it visible, sir?
Yeah, just make it full screen, please.
No.
Yeah, now it is much better.
Okay, so thank you so much, Saraprit sir, for this warm welcome. And thank you for the detailed introduction about the course, because we all need such type of courses. And at such a price, I think the price is very reasonable. It is not very expensive. And to all the participants, I would like to request to join this course, because we are not taught all these things in the medical school. And even if we are not treating the patients directly, we should actually be able to make a diagnosis or see where to which consultant we should be sending the patients to, because many of the patients are of psychological disorder, and we are sending them to a urologist. Some patients have physical illnesses, we are sending them to psychiatrists or counselors. So we should, in order to make such decisions, it is very necessary to have a basic knowledge about all the sexual problems which we are having. Okay, so talking about the topic sexual counseling, as we all know, it is very difficult to talk about sexual needs and beliefs of the people in the clinic after being a doctor also. And as we can see that Sarapri sir is himself is a gynecologist and an IVF expert. So talking about talking to the females directly is, I'm sure, very difficult for him, because we belong to a different gender and we have some taboos in the society. Okay, and above all, talking about sexual problems is very hectic and is very overwhelming for all the patients and as well as the counselors. So even if we are not talking very directly, or we are not talking very, you know, freely to the patient, at least we should know how to proceed for such cases and what we can do at our clinic so that we can actually break the ice. Okay, so moving on to the topic, sexual counseling. Uh, just a moment. Okay, so as we can see that despite major progress in of our understanding in sexual function and dysfunction, human sexuality issues are usually not discussed in the medical schools. And it is essential to know discuss about sex and sexuality openly and comfortably when we are working in the field of sexual medicine. Now, traditionally, we have seen that physicians usually see sexual problems as in terms of biomedical factors. But after psychological and social and relationship factors have been introduced, uh, we actually do not address these issues until there is a failure of medical interventions. Now, what are the common causes of failure of medical interventions in case of sexual issues? First, lack of motivation from both the partners. Sometimes the patient is not taking the medicines properly. Sometimes the partner of the patient is not cooperative. There are negative emotions attached to the problem, like how can you develop such problems, or how can I develop such problems? There is a definite amount of resentment or shame. Then there is a secret sexual life. These are very common in case of erectile dysfunction and premature ejaculation, that the patient is coming and telling you.
Yeah, you can start now.
Okay.
If you can start a little from the first slide, because if you've missed something, we can again, we can maybe run through a little quickly. Yeah.
Okay, no problem. So I have discussed that there could be lack of motivation from both the partners. There could be negative emotions related to the disease. There could be a secret sexual life, which the partner is holding, like he's masturbating very perfectly, but he's going through a lot of trouble when there is partner sexual intercourse. There could be sexual orientation issues. There are a lot of bisexual peoples around, and they are usually taking treatment for the other partner of the same gender. Okay, now there could be an extramarital affair that's around with wife, everything is fine, but with the partner, the other partner, things are not going so well. So kindly treat me. Then focus on fertility, but not value of sexuality. This is very common now because whenever the couple is trying for pregnancy, they are told to get intimate during the ovulation period, but the problem arises because they get that interpretation that we have to try only during the ovulation period, but not the other days of the month. So what they suffer is the patient, the male partner slowly loses the erection, and then there is no desire for sex left. Then we could have sexual trauma, hidden health issues such as eating disorder or bipolar disorder. There may be other disorders which have been misdiagnosed as, sexual problem, and there could be other issues like bipolar disorder, schizophrenia, or OCD or something like that. Then why there is a need of sexual counseling? First, to solve doubts. There are many apprehensions, there are many misconceptions in minds of the patients, so we need to solve their doubts. To cope up with the treatment failures, we need to explain why the treatment didn't work out, or why you went to a wrong doctor and the treatment didn't work out, or why my treatment didn't work out. Okay, then explore one's own sexual feelings. They have very much suppressed sexual emotions. So in order to explore their feelings, we need sexual counseling. Solve own sexual orientation or identity issues. Sometimes they are very much confused that they are either bisexual or they are homosexual, or should they marry or not. So we need to solve all these issues. Can provide a safe and supportive space for individuals. This is very important. There should be some centers, there should be some booths or some specific days in our OPD where we can talk freely about the sexual issues of the patient. Improvement of communication skills. Through sexual counseling, we can improve our communication skills, through the patient's communication skills, so that they can talk to each other very freely and help individuals and couples build a stronger, more satisfying, and a sexual relationship. Now, basic characteristics of a counselor. What are the basic things which are required? So, first is 4 C's. We required 4 C's like compassion, care, communication, and content. They should be non-judgmental. We should be non-judgmental because there are many differences among the age groups. There are many differences among the various areas, various cultural groups. Okay, they should be comfortable and familiar with the terminology. If we are not familiar with the medical terms, or if we are not familiar with the slang terms, it becomes very difficult to communicate with the people. They should be very they should understand the basics of underlying processes of reproductive and sexual physiology. Okay, so if you are not knowing about the basic resolution period, if you're not knowing about the basic length and of the vagina and the penis, or the multiple orgasms or single orgasms in males, it becomes very difficult. So we should know all these things. So they need to appreciate the range and variety of sexual expression. As I told you that we have a variety of sexual expressions, a variety of sexual emotions as per the age, gender, the cultures. We should know all these things. Then they must recognize the social implications of human sexual behavior. They should be persons who reflect on the related morals and ethical dilemmas also. Now, what are the guidelines for counseling practice? What do we need to know, or how we can become a good counselor in case of sexual dysfunctions? So, first of all, self-assessment. We should know about our values and beliefs so that we can ease out the patients and not just judge them. Okay, see continuing education. Like, you should upgrade your knowledge regarding all these things which are happening, and the new technology and the new theories and the new therapies, so that we can help the patient in different ways. Consider culture. As I told you, there are a lot of cultural differences, and we should all know about all these things. Be proactive and directive. Okay, so whenever there is a patient, whenever there is a concern, if you are not remembering the questions, you should have some ready, hand out some questionnaires. You can give it directly to the patient and ask them to fill in front of you, or while they're waiting outside in the OPD, and do initial assessments and use direct languages with clients. Okay, then we have to respect their limits. If we are asking the question, it is not necessary that the patient is able to answer, or he or she should answer the question. Okay, so we should know about the limits, and we should know about the consent. Now, guidelines for talking about some sensitive topics. There are some sensitive topics. If we are actually continuing the sexual counseling part, then also we have some sensitive topics where we need to consider the consent. Okay. Now, ask direct questions. First of all, we should ask direct questions. We should not try to beat around the bush. Okay. Explain clearly what you want to ask and why you are asking such questions. In such interviews, use formal expressions first. For example, you are using some scientific terms like vaginal intercourse, penis, vulva, or something like that. And if it is not understood by the patient, then you can turn to the slang expression so that it is very much easy and comfortable for the patient. Now, the counselor should check frequently to make sure that the client understands what is being said. After you are explaining something, try to ask the question that have you understood or not? Because sometimes they have a blank face, and you think that they are getting all the points which you are telling them. Okay, and as always, the counselor should respect the client's belief. Okay. Then, if we are talking about sexual counseling, we should know what are the common myths which need to be clarified in order to continue the therapy part. Okay, so first myth is masturbation is wrong. Second is satisfying a woman during sex is a man's job. It's a myth. Okay, a man feels like having sex all the time. This is also not true. A woman should always make love whenever her partner wants. No, here also consent is very important. A respectable woman should not enjoy sex too much and should certainly never masturbate. This is also not true. Role of physical strength or muscle power in sexual performance. Then we have size of the penis. This is the most common questions asked, especially by the young males of 15 to 30 years of age, before their marriage or even after their marriage. So this is a very common question. And last but not the least, this is a very debatable topic. Porn decreases sex potency. Okay, so all we should know what is the myth and what is the truth, and should always try to explain to the patient. Now, in order to make this sexual counseling process easy, we have a model which is known as PLICIT model. It's an abbreviation where P stands for permission, LI is limited information, then we have specific suggestions and intensive therapy. So permission, what do you mean by permission? So giving permission or asking permission from your patients to discuss their feelings or concerns about some sensitive topics, okay, like sexual in our case, that make them hesitant to discuss. So we are actually asking that we want to discuss something about your sex life, or they are asking us and we are giving permission that yes, we are ready to answer your questions regarding the sexual issues which you have. By encouraging this, their thoughts and questions become legitimate and you can actually proceed in a healthy manner. Then we have limited information. So limited information means providing a basic education about the topics and busting the misconceptions. Okay, not in very much detail, but the basic education and the myths. And information can be cleared out in the form of handouts. You can have some ready handouts which you can use. Then we have specific suggestions. There is a lot of treatment, there is a diagnosis, but what to do, which solution is appropriate? Because as we know, there are a there is a lot of information available on Google, and there are a lot of uneducated people who are trying to spread the information regarding sexual issues. Okay, so what solution which is very much necessary, which is very much optimum for that kind of problem, that needs to be discussed in specific suggestions. So involves advanced knowledge assessment and developing strategies for that health issue. Then last is intensive therapy. Here, after everything has been done, you can actually start an intervention or refer the patient to a proper professional. Okay, so let's discuss all these issues with some cases so we can get a very clear cut information. Okay, so I hope we all know who these people are. And I can see there are some people who are not from India, I hope, and uh, maybe not following the Indian pop culture more. So these two people are very much popular in India and have are very much celebrated celebrities, or we can say the romantic couples in India. Okay, and this I hope some people can recognize these two images. This belongs to a movie called as DD Ajit Dilwale Dulhaniya Le Jayenge. So I've actually made the presentation in such a way that we can actually relate such issues. Okay, we all know this scene, this what happened on that station that day, but what next? So as we can see, they got married, and after that there were lot of things happening. Like there was a lot of intimacy, there was a lot of romance. Then there are fights also. Then they are trying to make each other happy and whatnot. Okay, so let's start with the first case. So Raj and Simran are about to get married. On talking to Simran in a very romantic way, Raj realizes she belongs from a conservative family. Okay, she is shy and has some weird ideas about intimacy, sex, and childbirth. Her mother has taught her that there is sex for procreation only. There is no enjoyment attached to it. She should not enjoy sex at all, and the first few intercourses are very much painful, and there is no sex after childbirth for few years. Raj got scared and thought to take Simran to a counselor. Okay, so whenever we are getting such cases where premarital counseling is required, so the first step is reassurance. Okay, then we can tell them about. So first is reassurance. Then we have to respect the cultural differences and do not try to prove the patient wrong, especially on the very first session. Okay. Now start with basic anatomy and physiology. You have to start with the basic anatomy, physiology using diagrams or flow charts or something like that for both the partners. Do not assume here that if Raj has come for Simran's problem, or the male has come from for the female's problem, then the male is knowing everything about sex or intimacy. Okay, so try to communicate with both the patients. Then shift to menstruation. Okay, then what is the importance of foreplay? How the foreplay can be done? Importance of sex in terms of intimacy, recreation, bonding, and childbirth. Okay, and the last thing is tell Raj to go easy on her and not to rush. things. Okay. Then another case. Raj and Simran are about to get married. Before their marriage, Simran has decided to go cozy with Raj. Okay. Raj has some fantasies about oral sex in past few years. He asked Simran for it and she agreed because they recently went to a counselor. Okay. Now, while trying, Simran figured out that there is a foul smelling white discharge over the glans of the penis of Raj, and it is very bushy down there. She asked Raj to clean it up first, but they had an argument because Raj was very excited. Now, while getting intimate, Raj also faced some same issue with Simran. There was smell and it was bushy there also. Okay, so there was a fire smelling discharge near the vagina which turned down Raj's mood and he lost his erection. Okay, so along with premarital counseling, we have a topic of genital hygiene also. Okay, so the first step is again reassurance and anatomy physiology. So what are the direct advices which can be given is first get their hairs trimmed. Okay, not to shave, but trimming is very important. Suggest Raj and Simran to clean their genitals while bathing. Okay, daily. Now, use of soap and intimate wash is a debatable topic, but sometimes soaps and intimate washes are needed and they are good also. Now, cleaning of penis and vagina before and after oral and vaginal sex is very important. Use of condoms, use of dental dams in case of oral sex, brushing teeth and mouthwash after oral sex, and sex while bathing. So, this is a weird advice, but you can actually suggest that you can have sex during bathing so that all these things are um, under hygiene. Okay, then Raj is 27-year-old and Simran is 25 years old. Both got married 1 year back. Raj is too busy with his work and doesn't give much time to Simran. And Simran also gets busy with household work and gets tired by the night. Okay, at night, before sex, both are tired and try to finish the job quickly. No foreplay as such. Raj gets an erection and is able to penetrate sometimes and ejaculates within a minute. Okay, when he is unable to penetrate, he masturbates in front of Simran and gets satisfied. In both the situations, Raj leaves Simran alone after his ejaculation process is done and in vulnerable state and when she needs him the most. Okay, but Simran never complains. Okay, so this is a typical case where sexuality in the process has started, but positive sexuality is missing. Okay, so first of all, we need to tell them or counsel them about the time management and work and personal life balance. Okay, then pleasure and satisfaction of both the partners is very necessary. Ask husband to stop masturbation and take treatment for premature ejaculation as timing is very less and Raj gets embarrassed in front of Simran. So he should take the treatment for premature ejaculation. Okay. Then, as I mentioned, there is that they are both in a hurry and there is no foreplay. So we should always tell the importance of foreplay for both males and females. Basic anatomy and physiology of private part should be taught. Sexual response cycle we can actually tell them about in a very small and short way. And erotic parts of the female. There are many erotic parts in the female body which the female should also know and should tell to their male partners also. Now, what is the importance of communication, sexual and non-sexual, with the partner and the counselor? All these things are should be mentioned. Then another case is Simran and Raj are married recently. Okay, so first night, Raj is very anxious. He's very nervous and has asked his friend to get some condoms and with some some jelly which helps him to stay for a longer time and a Viagra, that is sildenafil 50 mg or 100 mg. His friend asked him why he is so nervous as he was a pro in sex 1 year back. So Raj replies that he has been masturbating only for a year and thinks he's getting weak. Now, he gets his stuff, he gets all the things which he demanded and consumes Viagra and has kept the condom ready for sex. But Raj is unable to maintain an erection, and after a few minutes, he gained an erection but lost it too quickly. Okay, this left Simran shocked. So this is a typical case of erectile dysfunction and performance anxiety, especially on the first night. So again, start with reassurance, importance of foreplay, as there was no foreplay because he was in a hurry to penetrate. Then we have negative effects of drug abuse. He asked for a Viagra, he asked for a condom which has a lubricant which increases the time. So we need to tell about the ill effects or the failure chances of such drugs and the condoms. Then relaxation and enjoyment. Teach about relaxation and enjoyment during intimacy and not just rush into penetration. Effect of long sexual abstinence, that for past 1 year, Raj was not sexually active and he has been masturbating only. So what are the positive effects and what are the negative effects of long sexual abstinence, that should be told. Now building intimacy rather than intercourse. So as they have just got married and they have never been into physical relationship, so building intimacy is more important or should be a priority rather than intercourse. Okay. Then we have control over distractions during foreplay and just before penetration. Raj has taken the drug. He was ready with an erection, but he didn't get an erection, or after sometimes he got an erection, which he lost very quickly. That means there are a lot of apprehensions, there are a lot of distractions during the intercourse or during the foreplay. Okay, that needs to be told. And proper use of condoms. Which condoms should be used for oral sex? Which condom should be used for vaginal sex? That has to be counseled. Okay. Sorry. Okay. Next case is Raj and Simran are married recently. First night is there. Now Simran is very scared. Okay. She's very nervous and asking her friend to get some condoms and a lubricating gel which should be anesthetic in nature. Okay. Now her friend asked her why she is so nervous, as sex is a very pleasurable thing and she'll love it. Simran replies that she has heard from some seniors that first few intercourses are very painful and that bleeds, which is making her very anxious. Now, when foreplay started, she resisted again and again. Raj tried to convince her, but she couldn't even open her legs for penetration. Since the very first night, there was no penetration at all. Okay, so this is a very clear-cut case of vaginismus and non-consummation. Okay, where the female actually doesn't have pain but complains of pain continuously, and there are anticipation of pain. Okay, so what she does is, there are many psychosomatic problems that she's getting pain. Okay, without any vaginal entry, she is not able to control that pain. She is not able to control that rigidness, that stiffness in her inner thigh muscles and the vaginal muscles. Okay, so in such cases, what we need to do is first reassurance. Okay, then arrange a separate session for husband and wife. This I have learned in my practice, that in case of non-consummation and especially vaginismus, there should be separate sessions also. Okay, so that the partner and the patient, they can discuss about the sexual practices or the sexual reactions which they get when they're getting intimate. Okay, now knowledge of anatomy, physiology, and the stretching capacity of the vagina. This needs to be told to Simran, that how much vagina can actually stress. Okay, then mirror exercise can be advised, that in some cases where the female is coming from a very conservative family and they are told not to touch their private part, they haven't seen their private part also. So for that, mirror exercise is very important. Then finger exercises can be advised, like for first few days, she can do it alone, and after that husband can be involved. So if there is any kind of foreign body anxiety or a penile penis anxiety, that can be resolved. Then sensate focus, we will be discussing that in further lectures. Sensate focus can be also taught and can take help of sexual reading material. So sometimes we need to actually, put things in patient's head, that you try to learn about sex and sexuality and try to build up a desire and an emotion through some reading materials or directly through porn. Okay, and avoid porn watching. We have to, tell Raj to avoid the porn watching, and directly also we should never tell the patients of vaginismus to watch porn, because that can turn into a horror movie for the female, right? Then another case is now they have been married for 2 years and Simran is pregnant 8 months. For past 8 months, Raj is trying to be intimate with Simran, but she denies always, saying that this is not safe for the baby. Okay. One night, Simran caught Raj masturbating in the bathroom and was very disappointed. On further asking, he mentioned that he has been doing it for past 8 months and there was an argument. Okay, so sex during pregnancy is a major challenge. Okay, so first of all, start with reassurance. Mention to Simran that masturbation at this stage is very normal and mutual masturbation can also be tried. Sex during pregnancy is safe, that can also be told, and use of condoms, toys, oral sex and foreplay should be suggested. And if they are indulging into sex, they can use the condoms, or if they are not indulging in partnered sex, they can use some toys. There can be oral sex only, and foreplay only can also be done. Now, there are certain safe sex positions that can be told, that should be told, and that should be shown to the couple, like standing and from behind, lying down. Okay, pregnant person on the top, reverse cowgirl position, and spooning. So these are some of the positions which can be used by the pregnant couple. Now, after 10 years of marriage, Simran is 35, Raj is 37 years old. Simran is a homemaker and Raj runs a family business and has to travel a lot. They have two children, 8 and 5 years old, who sleeps with their parents. There is a separate room, but they are still sleeping with their parents. Frequency of intercourse is once in 2 weeks as Raj is very tired. Simran is always alone in the house and so has become very inactive. She lost interest in everything and is sad, so she got diagnosed with depression. She's on her antidepressant for almost 3 years. Raj complains that she has lost interest in sexual activity, and Simran says that she feels she has become very fat and less attractive. So here in this case, we can see that there is a busy schedule, there is age, the both the children are sleeping with the parents, so there is no privacy. Okay, sexual frequency has decreased. Then we have loss of interest in everything. There is a diagnosis of depression. The antidepressants are there. There is complaint from the partner, and there is a negative body image also of Simran. So there are many things in this case. Okay, so we can say that this is a case of low libido, and the causes could be inactivity, the causes could be weight gain, negative body image, depression, and antidepressants. Okay, so first we'll start with reassurance. Find out the cause of depression. What is the cause of depression? Is the cause of depression monotonous life? Is the cause of depression not getting proper attention from the partner, or the cause of depression is actually getting very busy with household work or children? Okay, then consult her to a psychiatrist and try to change the antidepressant to such drugs which have less sexual side effects. Okay, this actually you can do. You can try to ask the psychiatrist to change the medicine. You can directly tell them that there are a lot of sexual side effects, or there are a lot of effects, and there is weight gain also, that so that they can change the drugs to some safer drug. Okay, indulge into physical activity. You have to ask Simran to indulge into some kind of physical activity so that she can lose some weight, and there is a good mood also. Make the children sleep in the other room. Though this is very difficult for the patients, I tell many of my patients, especially if they are coming after delivery 6 months or 8 months or 1 year, that this child is sleeping so in the same room, so there is a lot of distraction and they are not able to get proper time. Okay, then start with intimacy and masturbation. So directly jumping into penetration, they can start with intimacy and masturbation because there was a long gap, 9 months of pregnancy, and then the child is the child is very small, and there are many things, sleepless nights and tiredness because of the work. Okay, so instead of jumping directly into the penetration part, They should start with intimacy and masturbation, which can be solo masturbation and mutual masturbation. Now, get her some erotic material to use like stories and porn, which I told you earlier. Okay. Then Raj and Simran are now 47 and 45. Raj is mostly busy and tired with his work. Simran is also busy in household work and sometimes free during day and night time. Kids are grown up and have now left the home for higher studies. So she's alone usually. Whenever she is free, she thinks of her past sexual life and which was very satisfactory. In spite of taking regular treatment for ED and PME, Raj couldn't recover from his sexual health issues and has stopped making love. Simran also doesn't bother him and sometimes masturbates. Okay, and she really thinks of using some sex toys but wants a professional guidance. So, the first counseling here is not to give a bad image to Simran about the sex toys, but rather we can start with Raj. We can ask him to restart his treatment again so that there is intimacy and she doesn't have to use any kind of toy. When work and personal life balance, as we have discussed earlier, start with just foreplay and slowly move to penetrative sex. So this usually comes in sensate focus exercises. Then we have sex toys should be given as per demand and as per requirement, but we should tell them about maintaining of the proper hygiene of their private part and the sex toy, use of proper lubricants with the toy set so they do not get any kind of injury, and use of condoms with the toy. And mention very clearly that using a sex toy is good, but it may end their sex life forever. Okay. Now, Now Simran has developed diabetes and is under treatment. As Simran is from rural background, she has been taught that sex is a manly thing and she should not enjoy sex much and even complain about it. Due to low sexual frequency, Raj is suffering from weaker erections and early discharge and is under treatment also. Foreplay is up to 5 minutes because Raj is always in a hurry to perform penetrative sex with less foreplay. Okay, so this is a very clear-cut case of premature ejaculation in case of Raj. Okay, so first is reassurance. Second, a direct advice of increasing the amount of foreplay. Make a difference between hypersensitive glands and premature ejaculation. So here, genital examination is very important and see if there is a premature ejaculation or the glands is very hypersensitive. That is why he is losing an erection too quickly. Ask Raj to master. This is a weird advice, but you can actually give to Raj that he can masturbate 3 to 4 hours before the intercourse so that some of the secretions from the seminal vesicle and the prostate are actually gone. And sometimes this helps in increasing the time when during penetrative sex. Ask Raj to practice ejaculation control exercises like Kegels, and together they can do start stop. Together they can use start stop techniques or squeeze techniques, which is helpful after a few sessions of practice. Now, Raj is alcoholic and drinks almost every day. Raj forces Simran to have sex as he thinks that he has a good erection only with alcohol. Simran doesn't like Raj forcing her to have sex, which spoils her mood and reduces her desire. She also comes to know that Raj has a physical relationship with some other lady and she gets very irritated and she thinks about her husband and her past life, that she was about to get married to some other guy who was taller than Raj and who was bigger than Raj and he was more muscular, more manly than Raj. So she could, if she could have married that guy, then these problems would have never occurred. So we can see here that Simran is suffering from orgasmic issues. Okay, so first we'll try with reassurance. Make Simran understand when to say no. Okay, if Raj is forcing her, she has a right to say no. Advice to Raj to for alcohol de-addiction. Performance anxiety issues of Raj should be taken care of, and safe sexual practices should be advised, like use of condoms and genital hygiene if there is some other lady, and if she is a commercial sex worker. Ask Simran if she is focusing on her sensations or not. As I told you that this is a case of orgasmic issues. If Raj is actually forcing her after taking alcohol, and there are better erections and better performance, and Simran actually, because he has consumed alcohol, is not happy with him, and is not actually focusing on the better good erections of Raj, and the better performance of Raj. Simran is actually not focusing, and that is why also she's not getting any kind of orgasm. So ask Simran if she is focusing on her sensations during love making or is getting distracted because of the bad habits of Raj. Ask Simran if she was able to get an orgasm before or not. In order to make a diagnosis or to treat orgasmic issues, see if the female has a capacity of orgasm or not. Even if she is, complaining regularly that earlier she used to get orgasm, ask her that does she know what an orgasm feels like. Okay. And masturbation should be suggested in case of making a diagnosis if there is an orgasm or not, or there was an orgasm or not. Masturbation can be advised to the female. Now, Rehan is son of Rajan Simran, is 15 years old. He met with a friend Rehan, okay, and planned for a boys' night out. Rehan was clueless about the surprise his friend was about to give him. He switched on his laptop and asked Rehan to sit with him and watch porn. Rehan got very excited and got an erection, which he used to get earlier but had no idea what to do. Then they watched another video of few men masturbating, learned how to masturbate, and after an year, he visited the clinic telling that he has now become very thin, very weak, and is scared. He complains that because of his excessive masturbation, he is suffering from such side effects. And if he stops, there is semen discharge on his own. So there are two to three things here. One is the porn watching. Another one is masturbation habit and related guilt and anxiety. And there is semen discharge, like we call it as heart syndrome or night emissions. Okay, so porn addiction and masturbation addiction. So first start with reassurance. Second, try to find out why is he doing so. Is there stress? And because of stress, he's actually masturbating. He's actually procrastinating something. Is it just a habit or just before sleep because he has some sleep related issues? Ask him to go for some therapies like CBT and de-addiction from porn. Clear misconception about the normal masturbatory frequency. How many times in a week or in a day he can masturbate? Tell him about that. Provide information about basic anatomy and physiology, about the discharge of the semen, about the semen refilling and all. Okay, provide information about normal semen discharge in young males. How many times in a day or in a week the normal semen discharge can happen intentionally or on its own. Ask him not to be alone during nighttime and suggest the rules of sleep hygiene. Ask him to use some porn blockers so that he can actually get rid of porn watching and try to masturbate with the non-dominant hand. Okay, so Rehan, son of Rajan Simran, is 15-year-old. He's tense regarding his masturbation and night emissions. He saw on YouTube and read on Google the side effects of masturbation and has given up on himself. He has developed a penile size anxiety also. He feels that repeated masturbation has led to the size reduction. He also complains that his penis is not even close to the smallest penis as shown in the porn. Okay, so what is the influence of media and how we should deal with it is recheck the source of information. As I have seen, and many of you have seen in your practice, that patient's interpretation is very different from the information they have been reading or seeing. Okay, so check the information and uh, try to clear out that the misinterpretation. Provide information about the basic anatomy and physiology. Provide information about normal semen discharge in males. Okay, you should all have a penis size chart so that you can tell them about the various normal variations in size according to the country or according to the region. Okay, and inform him about the length of the vagina and the erogenous zone, that how much length is required for actually satisfying a female. Okay. Now, the last case, in later age, was diagnosed with cancer of prostate. He has been asked to get operated. The doctor told him that after the surgery, his penis size will reduce a few centimeters. After surgery, he must undergo chemotherapy and radiotherapy sessions also. And when he inquired about his sex life post treatment, the onco surgeon refused and told him to focus on the treatment first. Okay, so what to do in such cases is, first, again, the reassurance part. You can't pass on or receive cancer through sex. This needs to be told very clearly. Begin with intimacy, like talking about sex and kissing. You may produce less or no semen, but still can orgasm. Uh, for those of you who don't know, discharge of semen and orgasm, they are a simultaneous process. They go hand in hand, but these things are not a part and parcel of each other. Okay, so you can actually get an orgasm but still do not produce semen. So this is a normal thing, and even after a prostate cancer or chemotherapy or radiotherapy, this gets more common. Okay, it is safer for you to have nighttime emissions, and can masturbate whenever you feel like. So instead of starting with the intimacy, or instead of starting with penetrative sex, first you can actually prepare yourself by doing masturbation. You may need to use contraception for at least a year after the treatment. There is prehabilitation of sex, which we are doing at our clinic, cancer prehabilitation for penis cancer and prostate cancer and other cancers in case of males. And there is a sex toy which is known as a strap-on dildo. If the private part, the intimate part, like testicular surgery has been done, or prostate surgery, or penis surgery has been done, then they can use a sex toy which is known as strap on a dildo, so that they can actually get that feeling of intercourse, and the females can also get satisfied. Okay, so there are certain take-home points. Always try to ask sexual concerns of the patients. Sometimes you can shamelessly ask directly to the patient, as if you are knowing that these diseases or these therapies have some sexual concerns or some sexual dysfunction, you can ask directly. Increase awareness. Try to increase awareness. You can actually add some, posters or some kind of material on the notice board at the reception area, and increase awareness, or you can make some videos and post it on the social media. Then couple history taking and counseling is very important, otherwise the work is always and always half done. Always try to get the couple on the very first session. Not on If not on the very first session, then at least on the next sessions, because couple counseling or couple history taking is very important, and that only makes the diagnosis and the treatment complete. Okay, then every counseling needs patience and time. So to learn, we need patience and time, and to even make someone learn through our teachings, it takes some patience and time. And always seek guidance of physicians, gynecologists, endocrinologists, and finally sexologists. So if you are practicing, take help of the people who are working around you, who belong to some different specialty, who are masters of their professions. And if not, at least try to refer a patient to a sexologist. Thank you.
Thank you, Dr. Atmik, for that wonderful, insightful session.
Thank you, sir. Thank you so much.
There are no questions in the chat box, so if you I'll request the delegates to ask their questions. They can unmute themselves or they can write in the chat box, and we'll be happy to answer. Maybe you can unshare your screen in the meantime.
Sure, sir.
There was a mention of masturbation with non-dominant hand in one of the slides.
Yes, sir.
What was that actually? I just missed out on that. Can you explain again?
Sir, actually, what the psychotherapy has in case of masturbation addiction is one of the methods to, actually of de-addiction of masturbation, is try to use a non-dominant hand. So whenever we are using a non-dominant hand in masturbation, it reduces the amount of pleasure. It increases the amount of work to be done. So slowly, slowly they are getting the, pleasure, But the thing is, whenever they're getting the pleasure, they have to make a lot of effort with that. Okay, so that helps in de-addiction also, and sometimes it helps in increasing the time also. So it works in both ways.
So, if it's a little more pleasureful compared to the dominant hand for some people, then how do you de-addict them? I mean, it can bring in
Uh,
different response for different people, no?
yes, sir, true. But this is suggested for those people who are actually under the de-addiction program for masturbation.
Okay.
So if they are using their dominant hand, then that is masturbation only. So sometimes they are under the treatment, but they get very much frustrated and they are unable to control. So they do it with the dominant hand also.
Uh, there is some question in the chat box.
Yeah,
Sizes of penis and duration of sex, how they affect on male psychology.
sorry. Sir, can you repeat the question, please? Sizes.
So, yeah. So Deepak Kendra is asking sizes of penis and duration of sex. What is the effect on male psychology?
So the biggest obsession in males is the size of the penis, and that has actually come from the reference which they got from porn or from the friends. Once once you are into school, once you are in teenage, sometimes it happens that you are actually going to for urination with two, three friends. So they try to, sneak in the other urinal that how long is your penis, how big is your penis. And if someone actually comments that tera to chota hai, or you have a smaller penis, so that
Mm-hmm.
has a lot of, apprehension that is very shocking for that person or that child. So if the size of the penis is larger, they think that they will be able to perform better and they will be able to get their wife pregnant very early.
Mm-hmm.
And duration of sex is the penis size and duration of sex is has also uh, a direct correlation because again it comes from reference as they show in the penis as they show in the porn that whenever the male is actually removing his clothes after seeing the erection or the size of the erection, the female is getting very much excited that how big is the penis, and then they are able to perform in different positions also. So they
Mm-hmm.
both affect the psychology of male and females, both positively and negatively also.
Okay. So size does matter for some, and although it's truly speaking, it's not that relevant.
Yes, sir. So scientifically, it is not that relevant, but it matters to everyone. They want a bigger penis.
Okay. Savinder is asking in family planning, vasectomy is done. Can
Hmm.
the man get same pleasure after vasectomy during intercourse? So,
Yes, yes,
so it
they
has got
do.
no relation actually. Yeah.
Yeah, there is no relation of vasectomy with sexual pleasure.
Okay, another question for you, Dr. Atmik. How to eat for erectile dysfunction and male infertility? I mean, can you reframe this question? I mean, how to eat, what to eat, or can you unmute and ask? Are you able to understand the question? You can answer. I mean, I think what he means is maybe he's asking for some
What to eat?
tips. What to eat for erectile dysfunction?
So there is no specific diet for erectile dysfunction or male infertility, as you know better, sir. So the thing is, eat less, eat more fiber, eat less sugar, and eat less fatty meals, especially before intercourse. Okay, and try to do some exercise, especially the below the belt exercises. Okay, so there is no specific diet which is known to be very harmful except alcohol, smoking, and tobacco. And there is no specific diet which is very much useful for better erections or male fertility or infertility.
Cut down on fast food and excess
Yeah,
sugars and, exercise more.
yeah,
That's the key actually. So,
that's the key.
yeah.
But again, the thing is, after explaining all these things, many therapists, many senior psychiatrists, physicians, they do not talk about the one thing which is very important, and that is fantasy.
Mm.
If there is no fantasy, even after doing all these things, then you won't get proper erections, because there are a lot of patients who are gym instructors who are proactive in exercising and taking a proper diet, but they still have erection issues. So that is actually not physical but psychological. They are not able to focus. There is poor fantasy, or there has been porn usage and addiction. Okay, so diet is actually mental diet.
Something to do with the supplements they take, the androgens, excess androgens they take for, muscle building. Does that also influence sexuality in any way? Because it has a
Yes,
poor
sir.
impact on fertility, so.
Yeah. If there is an impact on fertility, there is some amount of impact in on erection quality and the desire part also. Okay, so these things are need to be regulated and used in a very limited way.
Okay. So, Arun is asking a brief idea of the course. I've posted a link of the course, and initially I have explained about the course. I'll just go back to the slide of the basic course which we are floating, which is going to start from 15th. Can you see the screen? I'll just go over. So the basic course starts with anatomy, physiology, and biochemistry of sexual function. Then Dr. Atmik will be talking on neuroendocrine pathways and sexual response cycle. Then we talk about the classification of sexual disorders, the pharmacology of sexuality, gender orientation issues, history taking, which is such an art in sexual dysfunctions. Then we go on to, talk about male and female dysfunctions, male and female sexual dysfunctions, and masturbation and Dhat syndrome, followed by a very interesting session on case discussions. But this is all about the basic course, and you can also refer to the advanced course on the website. The same topics will be dealt in great detail in the advanced course. So I encourage all of you to register for this course. The fees is only 6,500 Indian rupees or 80 US dollars. You can go to the website, and when you scroll down, there's a UPI link, there's a net banking, there's a Razorpay. All modalities of payment are available on the website, so you can choose your mode of payment. Atmik, I'm sure this is a very busy time. Thank you so much. We're really grateful that you could spare time out of your busy schedule.
My pleasure, sir. Thank you so
And
much for inviting.
thank you so much. Thank you so much. I'm ending the session, and any questions you can ask in the group, and we'll be more than happy to answer. During the course, after the course, every time we are available for you. Thank you so much. Thank you, Atmik.
Thank you, sir. Thank you, sir. Thank you. Take care. Bye.
Take care. Bye.